This is Dr. Stone-Gale, and I'm going to just do a brief overview of the written prescription assignment so you have some type of idea what your expectations are. You're going to be responsible to write two prescriptions for this assignment. The first one is for a medication, and the second one would be for a diagnostic test or a lab test. And the reason we do this is because it's really important when you go into the clinical site that, when you're with your preceptor, that you understand how to write prescriptions, because they may be having you write them and they'll sign them, but you want to have some type of idea on how to be able to write them. So the first one for the medication prescription is you're going to choose a medication of your choice that's related to the course content. So it doesn't matter if it's module 1 or module 10, it's anything in the course that you want to pick out and do. Don't go to cardiology, respiratory, GI, mental health, because that is not covered in this course. It must be a topic covered in the course. When you are writing your prescriptions, I want you to consider the diagnosis that you're treating and write according to the treatment guidelines. Therefore, if you are writing for specifically maybe BPH, benign prostatic hyperplasia, you want to make sure to look at the guidelines for treatment for that and go ahead and write it accordingly. So you would write your prescription, for example, for Flomax 0.4 milligrams, because that's the dose it comes in. You would not randomly pick 0.8 milligrams or 4 milligrams or something like that. So you want to make sure to look that you're writing the correct milligrams. On the prescription, you're going to make sure to have the patient's name, their address, their date of birth, the date of the prescription, and if you are writing a controlled substance, you'll need to have the DEA number there, so you can just make up a DEA number. And if you're writing a controlled substance, your date on the prescription needs to be written out. So for October, you would need to write, instead of 10 for the month, you would need to write out the word October. Also put on there any refills needed, so you can either type that in or you can circle it. And then sign with a fake name. You don't want to use your own name since you're not licensed yet, and I would never anticipate any problem with these prescriptions, but you want to make sure that you're just signing with a fake name. Your prescription should include the dose of the medication, the frequency that you're giving it, the type of medication you're giving, how it is taken, and the number that you're going to dispense to the patient, along with the refills. There are some students who make the same errors every semester, so I wanted to be very clear on some of the errors that students make. They forget to put the route down, so you need to make sure that you have it on your prescription. Are you giving it PO? Are you giving it IM? Are you giving it sublingual? Are you doing it as a patch? It just depends on what you're doing. So if you look at the example I've done here, the correct way to write for Singulair 10 milligrams would be 1 tablet PO daily at HS. You would not want to write it 10 milligram tablet daily HS. The pharmacist does not know how many tablets of the 10 milligram he's supposed to dispense with each dose, and to put that on the prescription bottle for the patient to know. So if you write Singulair 10 milligram tablet daily HS, he has no idea that you want 1 tablet, 5 tablets, 6 tablets. So be very clear: 1 tablet, 2 tablet, 3 tablets, however many daily, and the dose and the time you're giving it. So these are some of the common errors that students do lose points for. They really need to know the dose. And if you don't want the pharmacist to be calling you after hours, you don't want to be having them call you on the weekends, you don't want to have the patient sitting at the pharmacy waiting for their prescriptions and be inconvenienced. So make sure that you do write your prescriptions at correctly the first time. When you're using medical terms, when writing your prescriptions, it looks much more professional than if you don't do that. When you're sending your prescriptions out, remember, you're not giving the prescription to the patient to read. You're giving it to the pharmacist to read, who is a professional. The pharmacist's job is to break it down into layman terms on the prescription bottle for the patient. So when you're writing a prescription and you're giving it to the patient to give to the pharmacy, or it's going through electronically in your electronic medical record system, it's going to another professional who understands the medical terms. So if you're writing for 4 drops, it would be the medical symbol for drops, or for 4. And I've listed some here for 1, 2, 3, 4. Those are the most common ones that use the medical symbol for. The other ones you usually write out. You can write it out as a 1 if you choose. Often it's mistaken for a 7 when it's just written with the 1. So you want to be really careful not to use that. I have put a link here that you can use to go to, which is some abbreviations, medical abbreviations that might help you. And you do not need a diagnosis on your medication prescriptions. Is it wrong and will you lose points if you do put it on? No, but most of the time you don't need to do that. Your second prescription is for a diagnostic test or a lab test. So once again, you're going to choose a test of your choice related to the course content. So if you're treating somebody for a bladder infection, you would go ahead and consider the diagnosing the treatment guidelines for that diagnosis. And then the same goes for this: patient name, the address, the date of birth, the date of the prescription, and what specific test you're going to be writing for, the diagnosis, and then once again, you're going to sign it with a fake name. So on this prescription, you need to have only a couple things: just the type of the test that you're writing for and the patient's diagnosis or their symptoms. You may only have one symptom, you may have 2 symptoms. You don't need to be detailed. You don't need to put, write out a sentence and say the patient had a positive urinalysis that showed blood. You don't need to do any of that. You would just put urinalysis, diagnosis, hematuria, or diagnosis, dysuria, or diagnosis, back pain, something like that. But some of the common errors that students do make with this is they do not write the diagnosis, or they write the diagnosis next to the test. So for an MRI of the brain, some students write MRI of the brain for headache or due to headache. No, that's not what you do. You have to have specifically a diagnosis listed with the word DX or the word diagnosis. MRI of brain, DX, headache. Thyroid, same thing. TSH for thyroid problem. No, you don't want to write it like that. TSH diagnosis, you're either using the diagnosis they currently have, which could be hypothyroidism that they already have, and you're running a TSH to check their thyroid, or they've come in with complaints of fatigue. Maybe they've had weight gain. Maybe they're not sleeping, something like that, and you would use the symptom. So you can use a symptom, or you can use a diagnosis. If you're doing an MRI of the brain, you don't know a diagnosis yet, so you're really using a symptom. If you're sending the patient for a chest x-ray, you don't want to write, for pneumonia, because you don't know yet that the patient has pneumonia. You're doing a chest x-ray to find that out. So you could put cough and fever. But you don't need to get real detailed with the diagnosis symptoms of the patient, or the specific symptoms, excuse me. You have to have a diagnosis that correlates with the test for insurance billing purposes. You cannot do a test on something that you do not have a diagnosis for, because the patient will get the bill and the insurance company will not pay for it. So for an example, if you're going to do a test for a vitamin D level, you need to figure out what you're using for the diagnosis or the symptoms to come up with a diagnosis for that test. You can't just write vitamin D level, diagnosis is earache, for an example. Or you couldn't just write physical, because that's not good. They're not going to cover that. So make sure that you have some type of symptom or diagnosis that correlates with the actual test that you're writing for. Many students put refill, circle refill on this prescription, or they write a 1 or a 2 or a 3. I'm not sure why that's done. You do not put refills on prescriptions for diagnostic testing and lab tests. You only put them on for medications. So that's kind of just a brief overview of the assignment, and there are some very specific guidelines under the assignment tab for you to look at too. And if you have any questions, please let your faculty know.